It's an epidemic that impacts many people across the country. As we zone in now on Iowa, the Department of Health and Human Services saw in 2022 there were 237 deaths involving opioids. At the end of 2021, the state received an opioid settlement after certain prescription drug companies and pharmaceutical distributors engaged in misleading and fraudulent conduct. KIMT News 3's Sananda McCall tells us where that money sits now. Sananda?
Yeah, Cami, well, during this legislative session, the Iowa House and Senate weren't successful in getting the opioid settlement fund to the governor's desk. Nearly $46 million is in the fund and over $25 million is untouched. The Senate argued the state's Department of Health should decide how the money is divided, whereas the House argued a special committee should be created. But there is a bigger problem at hand.
It impacts everyone, including law enforcement.
We have a drug problem nationwide, and do I think it's getting better? No, I don't. I think if we think we get the handle on one drug, another one surfaces and sweeps the area.
As a vocal advocate in reducing the pains of the opioid epidemic, Governor Kim Reynolds announced this month a $17.5 million investment in opioid prevention and recovery programs for Iowans.
The opioid crisis is a human tragedy taking place across this country.
Funding includes $500,000 to an opioid use prevention campaign conducted by the Iowa Department of Health and Human Services, $1 million to an opioid prescription prevention program to provide training for nurses and physicians in prescribing opioids to surgery patients, and $3 million for a grant program to build a network of sober living homes. Without some of that funding, Kelly Granov with Mason City's Prairie Ridge Healthcare Facility says this.
I think the biggest barrier to North Iowa communities would have been where some of that community-based education is meant to be coming down. Some of our staff are working in the schools on programs that we know help reduce substance use among young people. So it could have delayed or suspended some of those services.
Iowa maintains one of the lowest overdose death rates in the country. We're still experiencing unacceptable trends. Overdoses are up by more than 34%. And for Iowans under 25, they're more than double.
With those trends, I'm told area doctors have been doing their part to not become a part of the problem, as opioids are often prescribed for pain.
Our medical providers and the leadership in our different medical facilities across North Iowa were very responsive a decade or more ago when it was obvious that something was happening.
Now, Iowa is expected to receive $144 million in total for the fund, which would be split between state and local governments for opioid treatment services. Cami?
Sananda, thank you. And Iowa is not alone. This year, Minnesota received nearly $4.5 million in an opioid settlement with a healthcare communications group on its role in the prescription drug crisis.